Community hospitals have been a key part of local health services for over 150 years, particularly in rural areas where they're a key local service. In recent years, there's been lots of changes in an era of austerity, with some services closing altogether or some hospitals losing their beds or changing their functions. However, in other areas of the country, local services have been keen to expand their community hospitals to play a greater role in local service delivery. Now, surprisingly, there's very little evidence about the role and the nature and the contribution of community hospitals. So in one sense, neither of those decisions can be fully evidence-based in terms of the research. And the study that we're publishing is one of the first of its kind. And it does three things. First of all, it maps the community hospitals and provides a publicly available database of all those different services and a definition of community hospitals. That may sound fairly basic, but we don't have that current information to date. Secondly, we have a really in-depth study of older people's experiences of using community hospital services and the experience of other patients, their families and staff. That's crucial, and patients in community hospitals tell us that their experience is much more positive than their experience in general acute hospitals, which they see as more remote, maybe colder, less person-centred than the care that they receive more locally and in community hospitals. And then third, we have a component that looks at the relationship between community hospitals and the local community in terms of what those hospitals do for the community and what the community does for the hospital, whether that's in terms of volunteering or fundraising, for example. And there we find that community hospitals play a key role as far as local communities are concerned. They provide a vital local service, they're an important source of local employment, they provide people with a sense of reassurance, they help people at really key and very difficult moments in their life. They really are very valued local health services, particularly in rural areas where other services may be under pressure as a result of the austerity agenda and where there may be very little other provision available. When we kind of conclude from the study as a whole, a number of the decisions we're having to make in the current policy context are very difficult, and we often talk about value for money. We wonder whether we need to focus just as much on the value element of that statement as we do on the money element of the statement, and whether we need a broader notion of what matters to local people when we're deciding about the future of local services.